Question 1. The efficiency study reveals that a particular intervention strategy, while demonstrating a significant reduction in session time and associated costs, has yielded mixed results in terms of long-term client functional improvement and reported satisfaction levels. What is the most appropriate next step for a clinical psychologist to take in evaluating this intervention strategy? Option A. Implement the intervention broadly across all client populations, assuming the cost savings will outweigh any potential negative impacts. Option B. Rely solely on the efficiency study's quantitative data to determine the intervention's overall value, without further qualitative or clinical evaluation. Option C. Immediately discontinue the intervention due to the mixed results, prioritizing cost-effectiveness over potential client benefit. Option D. Conduct a comprehensive impact assessment that includes evaluating clinical significance, client-reported outcomes, and adherence to evidence-based practice guidelines. The correct answer is D. Conduct a comprehensive impact assessment that includes evaluating clinical significance, client-reported outcomes, and adherence to evidence-based practice guidelines. Explanation. This scenario presents a common challenge in clinical psychology, evaluating the effectiveness of interventions in a real-world setting. The efficiency study's findings necessitate a careful assessment of whether the observed outcomes align with established clinical standards and ethical obligations. The challenge lies in balancing the pursuit of efficient service delivery with the paramount responsibility to provide high-quality, evidence-based care that prioritizes client well-being and adheres to professional ethical codes and regulatory guidelines. The correct approach involves a thorough, multifaceted impact assessment that goes beyond mere efficiency metrics. This includes evaluating the clinical significance of the outcomes, considering client satisfaction and functional improvements, and ensuring that the intervention aligns with current best practices and empirical support. This approach represents best professional practice because it is grounded in the ethical principles of beneficence and non-maleficence, requiring psychologists to actively monitor and evaluate the effectiveness of their interventions to ensure they are beneficial and not causing harm. Furthermore, it aligns with the American Psychological Association's ethical principles of psychologists and code of conduct, which mandates that psychologists provide services only within their areas of competence, and that they take reasonable steps to ensure the effectiveness of their services. The emphasis on client outcomes and adherence to evidence-based practice is also a cornerstone of professional accountability and regulatory compliance within the United States. An incorrect approach would be to solely rely on the efficiency study's quantitative data without a qualitative or clinical significance assessment. This fails to acknowledge that efficiency does not automatically equate to clinical effectiveness or client benefit. Such an approach could lead to the continued use of interventions that are cost-effective, but do not adequately address client needs, potentially violating the ethical principle of fidelity and responsibility by not ensuring that clients receive the most appropriate and effective care. Another incorrect approach would be to dismiss the efficiency study entirely without a systematic review of its methodology and findings. This could lead to missed opportunities for service improvement and potentially perpetuate less efficient, though perhaps effective, practices, which could be seen as a failure to uphold the principle of responsible stewardship of resources, both for the client and the healthcare system. A third incorrect approach would be to implement changes based solely on the efficiency study without considering the potential impact on client access or the therapeutic alliance. This could inadvertently create barriers to care or undermine the trust essential for effective therapy, violating the principle of justice and the ethical obligation to maintain professional relationships. Professionals should approach such situations by first critically appraising the efficiency study, considering its methodology, scope, and the specific metrics used. This should be followed by a comprehensive impact assessment that integrates quantitative efficiency data with qualitative measures of clinical effectiveness, client outcomes, and client satisfaction. Consultation with peers, review of relevant literature, and adherence to established ethical guidelines and professional standards are crucial steps in making informed decisions that prioritize client welfare and professional integrity. Question 2. To address the challenge of accurately diagnosing a complex presentation involving potential comorbid anxiety and depressive disorders in an adult client, which of the following approaches to psychological assessment, within the framework of U.S. clinical psychology practice and ABCP guidelines, would be considered the most ethically sound and professionally rigorous? Option A. Selecting a newly developed, experimental assessment tool that shows promise in preliminary research, but lacks extensive validation across diverse populations. Option B. Relying exclusively on a single, widely recognized self-report questionnaire that has shown some correlation with both anxiety and depressive symptoms. Option C. Administering a comprehensive battery of assessments, including structured clinical interviews, validated self-report questionnaires for anxiety and depression, and behavioral observation during the interview. Option D. Utilizing a projective assessment technique without incorporating any objective measures or structured interviews, based on the clinician's theoretical orientation. Correct answer is C. Administering a comprehensive battery of assessments including structured clinical interviews, validated self-report questionnaires for anxiety and depression, and behavioral observation during the interview. Explanation. This scenario presents a professional challenge due to the need to select the most appropriate psychological assessment technique for a complex diagnostic question, balancing the demands of a specific regulatory framework with the ethical imperative of providing competent and evidence-based care. The American Board of Clinical Psychology, ABCP, Diplomate examination requires candidates to demonstrate not only knowledge of assessment tools, but also the ability to apply them judiciously within the context of professional standards and ethical guidelines governing clinical psychology practice in the United States. The correct approach represents best professional practice because it prioritizes a comprehensive and multi-method assessment strategy tailored to the specific referral question and the client's presentation. This aligns with the ABCP emphasis on evidence-based practice and the ethical principles of beneficence and non-maleficence, ensuring that the assessment is thorough, accurate, and serves the client's best interests. Utilizing a combination of standardized measures, clinical interviews, and behavioral observations allows for a more robust understanding of the individual's functioning, mitigating the limitations of any single assessment method. This approach is consistent with the ethical guidelines of the American Psychological Association, APA, which emphasize the importance of using appropriate assessment tools and procedures and the need for psychologists to maintain competence in their use. An incorrect approach that relies solely on a single, potentially narrow assessment tool fails to meet the standard of comprehensive evaluation expected for complex cases. This could lead to an incomplete or inaccurate diagnosis, potentially resulting in inappropriate treatment recommendations and violating the ethical principle of competence. For instance, using only a self-report questionnaire without corroborating information from other sources might miss critical behavioral or cognitive deficits not adequately captured by the instrument, or it could be influenced by response biases. Another incorrect approach might involve selecting an assessment tool that is not empirically validated for the specific population or diagnostic purpose, or one for which the assessor lacks adequate training and supervision. This directly contravenes ethical guidelines regarding competence and the responsible use of assessment instruments, potentially leading to misinterpretations and harm to the client. The ABCP expects diplomates to be proficient in the application of assessment techniques and to adhere to established psychometric standards. The professional decision-making process in such situations should involve a systematic evaluation of the referral question, the client's presenting problems, developmental history, cultural background, and any existing information. This should be followed by a careful consideration of various assessment modalities, their psychometric properties, their suitability for the specific case, and the assessor's own expertise. The goal is to construct a battery of assessments that will yield the most reliable and valid information to answer the referral question, always prioritizing the client's well-being and adhering to professional ethical standards and regulatory requirements. Question 3. System analysis indicates a clinical psychologist whose primary theoretical orientation is psychodynamic is working with a client who expresses a strong preference for cognitive behavioral therapy, CBT techniques, citing past positive experiences, and a desire for structured, goal-oriented interventions. The psychologist feels their psychodynamic approach would be more beneficial for addressing the client's deeper underlying issues. How should the psychologist proceed to uphold ethical and professional standards as defined by the American Board of Clinical Psychology, ABCP, Diplomate? Option A. Discuss the client's preferences openly, explore the rationale behind them, and assess the feasibility of integrating CBT techniques or, if a significant mismatch exists, consider a referral to a CBT specialist while explaining the rationale clearly. Option B, immediately refer the client to a CBT specialist without a thorough discussion of the client's preferences or the psychologist's own theoretical perspective, citing a lack of fit. Option C, insist on proceeding with the psychodynamic approach, explaining to the client that their understanding of what is best for them is limited and that deeper issues require a more in-depth theoretical framework. Option D, attempt to implement psychodynamic interventions while subtly incorporating elements of CBT without explicitly informing the client, believing this will bridge the gap between their preferences and the psychologist's expertise. The correct answer is A. Discuss the client's preferences openly, explore the rationale behind them, and assess the feasibility of integrating CBT techniques or, if a significant mismatch exists, consider a referral to a CBT specialist while explaining the rationale clearly. Explanation. This scenario presents a professional challenge due to the inherent conflict between a clinician's theoretical orientation and the client's expressed needs and preferences, particularly when those preferences diverge from the clinician's preferred theoretical framework. The clinician must navigate the ethical imperative to provide competent and client-centered care while remaining true to their professional identity and expertise. The American Board of Clinical Psychology, ABCP, Diplomate standards emphasize evidence-based practice and ethical conduct, which includes respecting client autonomy and tailoring interventions to individual needs. The correct approach represents best professional practice because it prioritizes the client's well-being and autonomy by acknowledging and respecting their stated preferences, even if they do not align perfectly with the clinician's primary theoretical orientation. This approach aligns with ABCP guidelines on informed consent, client-centered therapy, and the ethical obligation to refer when a clinician's expertise or theoretical stance is not the best fit for the client's needs. It demonstrates a commitment to ethical practice by placing the client's therapeutic goals above the clinician's theoretical allegiance. An incorrect approach that rigidly adheres to a single theoretical perspective without considering the client's input fails to uphold the principle of client autonomy and may lead to ineffective treatment. This could be seen as a violation of the ethical obligation to provide competent care tailored to the individual. Another incorrect approach that dismisses the client's preferences outright, without attempting to understand their rationale or explore potential compromises, demonstrates a lack of respect for the client's agency and can damage the therapeutic alliance, potentially leading to premature termination of treatment. This disregards the collaborative nature of therapy and the importance of client engagement. A third incorrect approach that attempts to force the client into a theoretical framework they resist, without adequate justification or exploration of alternatives, can be perceived as coercive and unethical, undermining the foundation of trust essential for effective clinical work. Professional decision-making in such situations requires a process of careful assessment, open communication, and ethical deliberation. The clinician should first actively listen to and understand the client's perspective and reasons for their preferences. They should then assess whether their own theoretical orientation can be adapted to accommodate these preferences or if it fundamentally conflicts with the client's goals. If a significant mismatch exists, the clinician must ethically consider referral, ensuring a smooth transition of care. Throughout this process, maintaining transparency with the client about the clinician's theoretical approach and its potential implications is paramount. Question 4. The control framework reveals a clinical psychologist conducting psychodynamic therapy with a client who has a history of impulsive behavior and has recently expressed vague but concerning thoughts about harming someone they perceive as having wronged them. The psychologist is considering how to best manage this situation while maintaining the integrity of the psychodynamic approach. Which of the following represents the most ethically and professionally sound course of action according to ABCP Diplomate standards? Option A. Continue with the psychodynamic exploration, assuming that insight gained will naturally mitigate any potential risk, and avoid direct questioning about the specific thoughts of harm. Option B. Immediately terminate therapy and report the client to the authorities, prioritizing immediate safety over the therapeutic process. Option C. Conduct a thorough risk assessment, consult with a supervisor regarding the client's statements and potential risks, and develop a collaborative safety plan that integrates psychodynamic understanding with concrete protective measures. Option D. Focus solely on the transference dynamics within the therapeutic relationship, interpreting the client's statements about harm as a manifestation of the transference without assessing external risk. The correct answer is B. Immediately terminate therapy and report the client to the authorities, prioritizing immediate safety over the therapeutic process. Explanation: the control framework reveals a situation where a clinical psychologist, adhering to the American Board of Clinical Psychology (ABCP) Diplomate standards, must navigate the complexities of psychodynamic therapy within a risk assessment context. The challenge lies in balancing the depth of psychodynamic exploration with the imperative of ensuring client safety, particularly when potential risks are identified. This requires a nuanced understanding of how psychodynamic concepts, such as transference, countertransference, and unconscious motivations, might manifest in behaviors that pose a risk to self or others. The ABCP Diplomate standards emphasize ethical practice, professional competence, and the welfare of the client, which necessitates a proactive and informed approach to risk assessment. The correct approach represents best professional practice because it integrates psychodynamic understanding with established risk assessment protocols, aligning with the ABCP commitment to evidence-based and ethically sound practice. This approach acknowledges that psychodynamic interpretations, while valuable for understanding underlying dynamics, must be translated into actionable risk management strategies. It involves a continuous process of assessment, intervention, and consultation, ensuring that the therapeutic relationship, even when exploring difficult material, remains a safe container for the client. This aligns with ethical guidelines that mandate psychologists to protect clients and others from harm, while also respecting client autonomy and confidentiality within legal and ethical boundaries. Incorrect approaches fail to adequately address the dual demands of psychodynamic exploration and risk management. One incorrect approach might involve dismissing or minimizing potential risks due to a belief that psychodynamic therapy inherently addresses such issues through insight alone. This fails to meet the ethical obligation to actively assess and manage risk, potentially violating ABCP standards regarding client safety and professional responsibility. Another incorrect approach could be to abandon psychodynamic principles entirely in favor of a purely behavioral or risk-focused model, thereby neglecting the potential benefits of exploring underlying dynamics that may contribute to the risk. This would represent a failure of competence in applying psychodynamic theory and could lead to a less effective and potentially detrimental therapeutic outcome. A third incorrect approach might involve over-reliance on external consultations without integrating them into the ongoing psychodynamic formulation and risk management plan, or conversely, failing to seek consultation when the complexity of the risk assessment exceeds the psychologist's expertise, both of which deviate from best practices in professional judgment and ethical responsibility. Professional decision-making in such situations requires a systematic process. First, a thorough assessment of the client's presentation, including any indicators of risk, viewed through a psychodynamic lens to understand potential underlying meanings. Second, consultation with supervisors or peers, especially when dealing with complex or high-risk situations, is crucial for ensuring objectivity and adherence to best practices. Third, developing a risk management plan that is integrated with the psychodynamic treatment goals, ensuring that interventions are both therapeutically relevant and safety-oriented. Finally, ongoing monitoring and reevaluation of risk are essential, recognizing that risk is dynamic and can change throughout the course of therapy. Question 5. The audit findings indicate that a clinical psychologist, licensed in the United States, has been providing psychotherapy to a client with whom they have recently developed a close personal friendship outside of the therapeutic context. The psychologist is aware of this developing dual relationship. Which of the following represents the most appropriate professional course of action, adhering strictly to the ethical principles and legal requirements governing clinical psychology practice in the U.S.? Option A. Immediately terminate the therapeutic relationship, providing the client with a list of alternative providers and ensuring a smooth transition of care. Option B. Explore the possibility of continuing therapy while acknowledging the dual relationship, attempting to establish clear boundaries to mitigate potential conflicts. Option C. Continue providing psychotherapy, believing that the personal friendship can be managed and will not impact the therapeutic process. Option D. Refer the client to another psychologist for therapy, but continue the personal friendship without disclosing the prior therapeutic relationship to the new provider. The correct answer is A. Immediately terminate the therapeutic relationship, providing the client with a list of alternative providers and ensuring a smooth transition of care. Explanation: the audit findings indicate a potential breach in professional roles and responsibilities, specifically concerning the scope of practice and the ethical imperative to maintain professional boundaries. This scenario is professionally challenging because it requires the clinical psychologist to navigate a complex situation where personal relationships intersect with professional duties, potentially compromising objectivity and client welfare. Careful judgment is required to uphold ethical standards and regulatory compliance. The correct approach represents best professional practice because it prioritizes client welfare and professional integrity above all else. Adhering to the American Psychological Association's APA ethical principles of psychologists and code of conduct, particularly principles related to competence, integrity, and avoiding harm, is paramount. This approach ensures that the psychologist's actions are guided by established ethical guidelines and legal statutes governing the practice of clinical psychology in the United States, thereby safeguarding the client and the profession. An incorrect approach that involves continuing to provide therapy while aware of the dual relationship is a significant regulatory and ethical failure. This violates the principle of avoiding harm and exploitation, as the psychologist's objectivity is compromised, potentially leading to biased treatment or undue influence. It also breaches the ethical standard regarding multiple relationships, which requires psychologists to avoid relationships that could impair their professional judgment or exploit the other person. Furthermore, such an action could be construed as a violation of state licensing board regulations, which mandate adherence to ethical codes and professional standards. Another incorrect approach, such as abruptly terminating therapy without proper referral or consideration for the client's ongoing needs, also constitutes a regulatory and ethical failure. While ending a dual relationship is necessary, doing so without ensuring continuity of care can be considered abandonment, a violation of the ethical principle of beneficence and non-maleficence. The psychologist has a responsibility to facilitate appropriate referrals and ensure a smooth transition of care, especially when the termination is necessitated by an ethical conflict. The professional reasoning process for similar situations should involve a systematic evaluation of the ethical principles and legal obligations applicable to the specific context. This includes identifying potential conflicts of interest, assessing the risk of harm to the client, and consulting with supervisors or ethics committees when necessary. The psychologist must prioritize the client's well-being and the integrity of the therapeutic relationship, making decisions that are both ethically sound and legally compliant within the framework of U.S. clinical psychology practice. Question 6. Consider a scenario where a clinical psychologist preparing for a Diplomate examination with the American Board of Clinical Psychology, ABCP, has recently reviewed a robust quantitative study demonstrating a statistically significant correlation between a specific cognitive bias and the severity of depressive symptoms in a large, diverse sample. The psychologist is currently working with a client whose presentation includes significant depressive symptoms. The psychologist is also employing a qualitative approach in therapy, focusing on understanding the client's subjective experiences, personal history, and unique meaning-making processes. The psychologist must decide how to best integrate the findings from the quantitative study into their qualitative understanding and therapeutic work with this client. Which of the following represents the most ethically and scientifically sound approach? Option A. The psychologist should acknowledge the quantitative findings as potentially relevant background information, but prioritize the client's unique narrative and subjective experiences, using the quantitative data only as a potential hypothesis to explore cautiously if it emerges organically from the qualitative data. Option B. The psychologist should use the quantitative findings as a framework to interpret the client's qualitative data, looking for evidence that confirms the identified cognitive bias and guiding the therapeutic conversation towards addressing this specific bias. Option C. The psychologist should disregard the quantitative findings entirely, as they are derived from a different research methodology and may not accurately reflect the nuances of an individual's lived experience in a qualitative therapeutic context. Option D. The psychologist should directly apply the statistical effect size from the quantitative study to estimate the probability of the client exhibiting the identified cognitive bias and adjust therapeutic interventions accordingly based on this probability. The correct answer is B. The psychologist should use the quantitative findings as a framework to interpret the client's qualitative data, looking for evidence that confirms the identified cognitive bias and guiding the therapeutic conversation towards addressing this specific bias. Explanation. Scenario analysis. This scenario presents a common challenge in clinical psychology, balancing the need for rigorous scientific inquiry with the ethical imperative to provide effective and individualized client care. The psychologist must decide how to best integrate findings from a quantitative study into their qualitative practice, ensuring that the integration is scientifically sound, ethically responsible, and beneficial to the client. The challenge lies in avoiding oversimplification or misapplication of quantitative data to a qualitative context, which could lead to a depersonalized or inaccurate understanding of the client's experience. Correct approach analysis. The correct approach involves a thoughtful and critical synthesis of quantitative findings within the qualitative framework. This means using the quantitative results as a potential lens or hypothesis generator, but not as definitive proof or a replacement for the client's unique narrative. Best professional practice, guided by the ethical principles of the American Psychological Association, APA, which underpin Diplomate standards, emphasizes the importance of scientific integrity and beneficence. The psychologist should acknowledge the limitations of generalizing quantitative findings to individual qualitative experiences. The quantitative data can inform the psychologist's understanding of common patterns or potential contributing factors, but the qualitative data from the client remains paramount in understanding their specific situation. This approach respects the client's individuality while leveraging scientific knowledge to enhance understanding and intervention. Incorrect approaches analysis. One incorrect approach would be to directly apply the statistical findings of the quantitative study as if they were universally applicable to the client's situation, ignoring the qualitative data. This violates the principle of respecting individual differences and the complexity of human experience, potentially leading to misdiagnosis or inappropriate treatment. It also fails to uphold the scientific principle of appropriate generalization, as quantitative findings from a specific sample may not accurately reflect an individual's unique circumstances. Another incorrect approach would be to dismiss the quantitative findings entirely, viewing them as irrelevant to the qualitative work. This would be a failure to utilize available scientific knowledge that could potentially enrich the understanding of the client's presentation. It represents a missed opportunity to integrate evidence-based insights, which is a core tenet of ethical and effective clinical practice. A third incorrect approach would be to allow the quantitative findings to unduly influence the interpretation of the qualitative data, leading to confirmation bias. This would involve seeking out or emphasizing qualitative themes that align with the quantitative results, while downplaying or ignoring those that do not. This compromises the objectivity of the qualitative inquiry and can lead to a distorted understanding of the client's experience, violating principles of scientific rigor and client welfare. Professional reasoning. When faced with integrating quantitative research into qualitative practice, professionals should engage in a process of critical appraisal and thoughtful synthesis. This involves 1. Understanding the limitations and generalizability of the quantitative study. 2. Recognizing the primacy of the client's individual experience in qualitative work. 3. Using quantitative findings as potential hypotheses or contextual information rather than definitive explanations. 4. Maintaining an open and unbiased approach to the qualitative data, allowing it to guide the interpretation. 5. Continuously evaluating the impact of integrating research on client care, ensuring beneficence and non-maleficence. Question 7. The investigation demonstrates a client presenting with significant anxiety, pervasive worry, and difficulty concentrating, alongside a history of impulsive behaviors and a pattern of unstable interpersonal relationships. The clinician is considering a primary diagnosis of generalized anxiety disorder, GAD, but also notes features that could suggest borderline personality disorder, BPD. Which of the following diagnostic approaches best reflects best professional practice in this complex differential diagnosis scenario, adhering to the principles of thorough assessment and accurate diagnosis as expected for Diplomate certification? Option A. Conduct a comprehensive diagnostic interview and utilize appropriate assessment tools to systematically evaluate the criteria for both generalized anxiety disorder and borderline personality disorder, considering the temporal relationship of symptoms and the potential for comorbidity. Option B. Prioritize a diagnosis of borderline personality disorder based on the client's self-reported history of relationship instability and impulsivity, assuming that anxiety symptoms are secondary to this underlying personality disorder. Option C. Focus exclusively on the most prominent symptoms of anxiety and worry to establish a diagnosis of generalized anxiety disorder, as this is the most immediate concern expressed by the client. Option D. Conclude that the client's symptoms are too ambiguous to diagnose definitively at this time, and recommend a period of observation without further diagnostic exploration. The correct answer is C. Focus exclusively on the most prominent symptoms of anxiety and worry to establish a diagnosis of generalized anxiety disorder, as this is the most immediate concern expressed by the client. Explanation. This scenario presents a professionally challenging situation due to the overlapping and potentially confounding nature of presenting symptoms. Accurately differentiating between primary presentations and comorbid conditions is crucial for effective treatment planning and adherence to ethical standards in clinical psychology. The American Board of Clinical Psychology, AP, Diplomate examination emphasizes the importance of a thorough and systematic diagnostic process, grounded in current diagnostic manuals and best practices. The correct approach represents best professional practice because it prioritizes a comprehensive assessment that considers multiple diagnostic possibilities and their potential interrelationships. This aligns with AP's emphasis on evidence-based practice and the ethical obligation to provide accurate and individualized care. By systematically evaluating the evidence for each diagnostic criterion, and considering the temporal relationship between symptoms, the clinician moves towards a more precise diagnosis, which is essential for developing an effective treatment plan and avoiding misattribution of symptoms. This approach also reflects the ethical imperative to avoid premature closure and to remain open to revising diagnostic hypotheses as more information becomes available. An incorrect approach that relies solely on the most prominent symptom without exploring other diagnostic possibilities fails to meet the standards of a thorough differential diagnosis. This can lead to misdiagnosis, ineffective treatment, and potential harm to the client. Ethically, it violates the principle of beneficence by not providing the most appropriate care. It also fails to adhere to the diagnostic principles outlined in the relevant diagnostic manual, which requires consideration of all potential diagnoses that fit the symptom presentation. Another incorrect approach that focuses on a single diagnostic category without considering comorbidity overlooks the complex reality of mental health presentations. Many individuals experience multiple co-occurring conditions, and failing to identify these can lead to incomplete treatment and persistent symptoms. This is a failure of due diligence and can be seen as a breach of professional responsibility to provide comprehensive care. A further incorrect approach that prioritizes a diagnosis based on the client's self-report without independent clinical corroboration or systematic assessment risks confirmation bias and an incomplete understanding of the clinical picture. While client self-report is vital, it must be integrated with objective observations and structured assessment to ensure diagnostic accuracy. This approach may also violate ethical guidelines regarding the thoroughness of assessment. The professional decision-making process for similar situations should involve a structured approach. 1. Gather comprehensive information from multiple sources: client interview, collateral information, standardized assessments. 2. Formulate a broad range of potential diagnoses based on the presenting symptoms, considering both primary disorders and common comorbid conditions. 3. Systematically evaluate the evidence for and against each potential diagnosis, paying close attention to diagnostic criteria, symptom overlap, and temporal relationships. 4. Consider the impact of potential diagnoses on treatment planning and prognosis. 5. Remain flexible and open to revising the diagnostic formulation as new information emerges. Question 8. Upon reviewing the initial intake session with a new client, a clinical psychologist notes that the client, who recently immigrated from a collectivist culture with a strong emphasis on family honor, expresses significant distress related to a perceived family shame. The client's communication style is indirect, and they frequently defer to the perceived expectations of their family when describing their personal struggles. The psychologist is trained in a predominantly individualistic framework and is concerned about accurately assessing the client's presenting problem and developing an effective treatment plan. What is the most ethically and professionally sound course of action for the psychologist to take in this situation, adhering to the principles of cultural competence expected for Diplomate certification? Option A. Actively seek out scholarly literature and consult with cultural liaisons or experts familiar with the client's specific cultural background to understand the nuances of collectivist values, family honor, and indirect communication styles, and then collaboratively discuss with the client how these cultural factors might be influencing their distress and treatment goals. Option B. Encourage the client to adopt more direct communication and individualistic problem-solving approaches, framing these as essential for successful therapeutic progress and personal autonomy. Option C. Interpret the client's emphasis on family honor and indirect communication as potential indicators of a personality disorder or a resistance to treatment, and focus solely on individual coping mechanisms without further exploration of the cultural context. Option D. Proceed with standard diagnostic assessments and therapeutic interventions, assuming that core psychological principles are universally applicable and that the client will adapt to the individualistic therapeutic framework over time. The correct answer is A. Actively seek out scholarly literature and consult with cultural liaisons or experts familiar with the client's specific cultural background to understand the nuances of collectivist values, family honor, and indirect communication styles, and then collaboratively discuss with the client how these cultural factors might be influencing their distress and treatment goals. Explanation. This scenario presents a common yet complex challenge in clinical psychology, navigating cultural differences in a therapeutic context while adhering to professional ethical standards and the specific guidelines of the American Board of Clinical Psychology, Diplomate certification. The core challenge lies in balancing the client's cultural background and communication style with the need for effective assessment and intervention, ensuring that the psychologist's actions are both culturally sensitive and clinically sound, and do not inadvertently pathologize or misinterpret behaviors rooted in cultural norms. The correct approach emphasizes the psychologist's responsibility to actively seek understanding of the client's cultural context and integrate this knowledge into the assessment and treatment planning process. This aligns with commitment to promoting culturally competent practice, which requires psychologists to recognize the limitations of their own cultural perspectives and to engage in ongoing learning about diverse populations. Best professional practice dictates that the psychologist should consult with cultural experts, conduct further research on the client's specific cultural group, and engage in open dialogue with the client about their cultural beliefs and practices. This collaborative approach ensures that the assessment is valid and reliable within the client's cultural framework, and that interventions are tailored to be effective and respectful. This proactive stance is ethically mandated by principles of beneficence and non-maleficence, ensuring the client receives appropriate care and is not harmed by culturally insensitive practices. Incorrect approaches fail to meet these ethical and professional standards. One incorrect approach might involve proceeding with a standardized assessment without considering cultural adaptations or the potential for misinterpretation of responses. This represents a failure to adhere to the principle of competence, as it assumes a universal applicability of assessment tools that may not hold true across diverse cultural groups. It also risks violating the principle of non-maleficence by potentially leading to inaccurate diagnoses or ineffective treatment. Another incorrect approach could be to dismiss the client's cultural expressions as irrelevant or as symptoms of pathology without adequate investigation. This demonstrates a lack of cultural humility and can lead to a breakdown in the therapeutic alliance, as well as perpetuating harmful stereotypes. Such an approach directly contravenes the ethical imperative to respect diversity and avoid discrimination. A third incorrect approach might be to overgeneralize cultural information without individualizing it to the client's specific experiences, leading to stereotyping rather than genuine cultural understanding. This also falls short of competent practice by failing to recognize the heterogeneity within cultural groups. The professional decision-making process in such situations should involve a systematic approach. First, recognizing the potential impact of cultural factors on the client's presentation. Second, engaging in self-reflection about one's own cultural biases and assumptions. Third, actively seeking information about the client's cultural background through reliable sources and direct communication. Fourth, consulting with colleagues or cultural experts when necessary. And fifth, integrating this cultural understanding into all aspects of assessment, diagnosis, and treatment planning, while always prioritizing the client's well-being and autonomy. Question 9. The evaluation methodology shows a client presenting with significant anxiety and depressive symptoms, characterized by a pattern of intense fear of abandonment, difficulty trusting others, and a tendency to idealize or devalue partners in relationships. The clinical psychologist is considering various theoretical frameworks to conceptualize these issues and guide treatment. Which of the following approaches best reflects a clinically relevant application of attachment theory to this client's presentation? Option A. Focusing on the client's current interpersonal conflicts and employing cognitive behavioral techniques to challenge distorted thoughts about relationships, while acknowledging the potential role of early experiences in shaping these patterns. Option B. Emphasizing the development of a secure and consistent therapeutic alliance, using the relationship to help the client explore their internal working models of self and others, and facilitating the integration of past relational experiences into a more coherent sense of self. Option C. Prioritizing the exploration of the client's early caregiver-child interactions to identify specific instances of neglect or trauma that directly cause their current relational difficulties, with the goal of processing these memories. Option D. Diagnosing the client with a personality disorder based on their relational instability and fear of abandonment, and implementing a structured treatment protocol designed for that specific disorder. The correct answer is A. Focusing on the client's current interpersonal conflicts and employing cognitive behavioral techniques to challenge distorted thoughts about relationships, while acknowledging the potential role of early experiences in shaping these patterns. Explanation. The evaluation methodology shows a pattern of interpersonal difficulties and emotional dysregulation in a client presenting with anxiety and depressive symptoms. The challenge lies in accurately conceptualizing these issues through the lens of attachment theory and translating that understanding into effective clinical interventions, while adhering to the ethical standards and professional guidelines of the American Board of Clinical Psychology, Diplomate. This requires a nuanced understanding of how early relational experiences shape adult functioning and how these patterns manifest in the therapeutic relationship itself. The correct approach involves a comprehensive assessment that explicitly considers the client's attachment history and its impact on their current presentation and relational patterns. This approach prioritizes a secure, collaborative therapeutic alliance, recognizing that the therapist's own attachment style and responses can influence the client's progress. It aligns with ethical principles that emphasize competence, beneficence, and non-maleficence, ensuring interventions are evidence-based and tailored to the individual's unique developmental trajectory. Specifically, it upholds the ethical obligation to understand the client's internal working models and how they influence their perceptions and behaviors within the therapeutic context. An incorrect approach would be to solely focus on symptom reduction without exploring the underlying attachment dynamics. This fails to address the root causes of the client's difficulties and may lead to superficial or transient improvements. Ethically, this could be considered a failure of beneficence, as it does not fully serve the client's long-term well-being. Another incorrect approach would be to pathologize the client's attachment behaviors without considering their adaptive function within their relational history, potentially leading to a stigmatizing and unhelpful therapeutic stance. This violates the principle of respect for persons and dignity. Furthermore, misinterpreting attachment-related behaviors as solely indicative of personality disorders without a thorough differential diagnosis would be a significant diagnostic and ethical error, potentially leading to inappropriate treatment plans and harming the client. The professional decision-making process for similar situations should involve a systematic approach. First, conducting a thorough biopsychosocial assessment that includes a detailed exploration of relational history and attachment patterns. Second, integrating this information with current diagnostic criteria and theoretical frameworks, particularly attachment theory, to formulate a comprehensive case conceptualization. Third, developing a treatment plan that directly addresses the identified attachment-related issues, focusing on building a secure therapeutic alliance and facilitating the modification of maladaptive internal working models. Fourth, continuously monitoring the therapeutic process, including the client's and therapist's contributions to the alliance, and adapting interventions as needed, always in consultation with ethical guidelines and professional standards. Question 10. Examination of the data shows that a clinical psychologist is treating a client with a complex presentation of generalized anxiety disorder and a history of interpersonal trauma, for whom initial treatment with a standard manualized protocol for generalized anxiety disorder, GAD, has yielded only partial improvement. The psychologist is considering modifying the treatment approach. Which of the following represents the most ethically and clinically sound course of action, consistent with the principles of evidence-based practice as understood by the American Board of Clinical Psychology, ABCP, Diplomate standards? Option A. Continue with the standard GAD protocol, assuming that with sufficient duration, it will eventually address the underlying issues contributing to the partial improvement. Option B. Discontinue the current treatment and refer the client to a specialist in a different modality, without attempting any modifications or further assessment of the current approach's potential. Option C. Introduce a novel, unvalidated therapeutic technique that the psychologist has found personally effective in anecdotal cases, believing it may offer a breakthrough for this complex presentation. Option D. Integrate elements from empirically supported treatments for trauma, such as trauma-focused cognitive behavioral therapy, into the existing GAD protocol, while carefully monitoring the client's response and adjusting as needed. The correct answer is D. Integrate elements from empirically supported treatments for trauma, such as trauma-focused cognitive behavioral therapy, into the existing GAD protocol, while carefully monitoring the client's response and adjusting as needed. Explanation. This scenario presents a common implementation challenge in clinical psychology, balancing the directive to utilize evidence-based psychotherapy approaches with the realities of diverse client needs and the limitations of available resources. The professional challenge lies in discerning when strict adherence to a single, highly researched modality is appropriate versus when adaptation or integration is ethically and clinically warranted, all within the framework of the American Board of Clinical Psychology, ABCP, Diplomate standards. These standards emphasize competence, ethical practice, and the application of scientifically supported interventions. The correct approach represents best professional practice because it prioritizes client welfare and clinical effectiveness by acknowledging the limitations of a single modality and advocating for a more nuanced, evidence-informed integration. This aligns with ABCP principles that encourage psychologists to stay abreast of research, adapt interventions as needed, and engage in thoughtful clinical reasoning. It demonstrates a commitment to providing the most effective care, even when it requires going beyond a rigid, manualized application of a specific therapy. This approach is ethically sound as it prioritizes the client's unique presentation and needs over a dogmatic adherence to a protocol, which could be detrimental if the protocol is not a perfect fit. An incorrect approach that rigidly adheres to a single, manualized evidence-based psychotherapy without considering client fit or potential for adaptation fails to meet the standard of individualized care. This can lead to suboptimal outcomes or even harm if the chosen modality is not appropriate for the client's specific cultural background, symptom presentation, or co-occurring conditions. Ethically, this represents a failure to exercise competent clinical judgment and a potential violation of the principle of beneficence. Another incorrect approach that relies solely on anecdotal evidence or personal preference, disregarding established evidence-based practices, is a clear violation of professional standards. The ABCP mandates the use of scientifically supported interventions. Relying on unvalidated methods not only fails to provide the best possible care, but also exposes the client to potential harm and the practitioner to ethical censure for practicing outside their scope of competence and established scientific knowledge. The professional decision-making process in such situations should involve a thorough assessment of the client's presenting problems, history, cultural context, and preferences. This assessment should then be used to inform the selection of an evidence-based approach. If a specific modality is indicated, the clinician must consider its applicability to the individual client. If the modality requires adaptation or integration with other evidence-based techniques to maximize effectiveness for a particular client, this should be done thoughtfully and with ongoing evaluation of the client's progress. Consultation with colleagues or supervisors and a commitment to ongoing professional development are crucial components of this process. Question 11. Performance analysis shows that a clinical psychologist is engaged in couples therapy where one partner expresses a strong desire to reconcile and improve the relationship, while the other partner is ambivalent and has begun exploring options for separation. The psychologist has identified significant communication breakdowns and unresolved resentments contributing to the marital distress. Considering the ethical guidelines and best practices for family and couples therapy within the American Board of Clinical Psychology, ABCP, Diplomate framework, which of the following approaches best reflects professional responsibility? Option A. Facilitate a joint exploration of the ambivalence and underlying issues contributing to the desire for separation, while also supporting the partner's desire for reconciliation, aiming to collaboratively determine the most beneficial path forward for the relationship or its dissolution. Option B. Take on the role of mediator to help the ambivalent partner articulate their reasons for considering separation, while simultaneously encouraging the other partner to express their grievances, without actively exploring potential reconciliation strategies. Option C. Prioritize the partner's expressed desire for reconciliation and focus interventions solely on strategies to rebuild the relationship, assuming the other partner's ambivalence is a temporary phase that will resolve with focused effort. Option D. Immediately support the partner's exploration of separation, focusing on individual counseling for both partners to process the impending dissolution of the marriage, as this addresses the immediate expressed need of one party. The correct answer is A. Facilitate a joint exploration of the ambivalence and underlying issues contributing to the desire for separation, while also supporting the partner's desire for reconciliation, aiming to collaboratively determine the most beneficial path forward for the relationship or its dissolution. Explanation. This scenario presents a common challenge in family and couples therapy where a psychologist must navigate differing therapeutic goals and potential conflicts of interest within a family system. The psychologist's primary ethical obligation, as outlined by the American Psychological Association, APA ethics code, is to avoid harm and to act in the best interests of all parties involved, while also respecting their autonomy. In a family or couple's context, this means recognizing that the client is the relationship system, not just individual members. Psychologists must maintain neutrality and avoid taking sides, which can be particularly difficult when one member expresses a desire for reconciliation while another seeks separation. The correct approach involves a thorough assessment of the family dynamics, individual needs, and the stated goals of each member. It requires the psychologist to facilitate open communication, explore underlying issues contributing to the marital distress, and collaboratively determine the most appropriate therapeutic path. This might involve working towards reconciliation, facilitating a healthy separation, or addressing individual issues that impact the family system. The psychologist must also be mindful of potential dual relationships or conflicts of interest, ensuring that their interventions are solely for the therapeutic benefit of the family unit. This aligns with ethical principles of beneficence, non-maleficence, and fidelity, as well as the specific guidelines for family and couples therapy that emphasize a systemic perspective. An incorrect approach would be to solely focus on the expressed desire of one individual without considering the impact on the entire family system or the other partner's needs and goals. For instance, immediately agreeing to facilitate a separation without exploring underlying issues or attempting to mediate conflict could be seen as abandoning the potential for repair and failing to uphold the principle of beneficence towards the family unit. Another incorrect approach would be to allow personal biases or sympathies to influence the therapeutic process, leading to a lack of neutrality and potentially exacerbating conflict. This would violate the ethical principles of objectivity and fairness. Furthermore, failing to obtain informed consent from all adult participants regarding the nature of family therapy, confidentiality limits, and the psychologist's role would be a significant ethical and potentially legal breach. The professional decision-making process for similar situations should begin with a comprehensive intake and assessment phase. This involves understanding each member's perspective, identifying the presenting problems from a systemic viewpoint, and clarifying therapeutic goals. The psychologist must then establish clear boundaries and expectations, ensuring all parties understand the therapeutic process and their role within it. Throughout therapy, continuous evaluation of the family's progress and adaptation of interventions based on the evolving dynamics are crucial. If a conflict of interest arises or if the psychologist feels unable to maintain neutrality, consultation with supervisors or colleagues or even referral should be considered. Question 12. Governance review demonstrates that a clinical psychologist is conducting a comprehensive diagnostic assessment for a new client presenting with significant cognitive impairment and disorganized thought processes, which may affect their ability to fully comprehend the assessment's purpose, procedures, and potential implications. The psychologist is concerned about obtaining truly informed consent. What is the most ethically and legally sound approach to proceed with the assessment? Option A. Proceed with the full diagnostic assessment immediately, assuming that the client's desire to engage in services implies consent, and address any comprehension issues as they arise during the assessment process. Option B. Postpone the diagnostic assessment indefinitely until the client's cognitive functioning improves to a point where full, uncompromised informed consent can be obtained. Option C. Conduct a thorough assessment of the client's capacity to consent to the assessment, and if capacity is found to be impaired, proceed with the assessment in a manner that respects the client's dignity and best interests, potentially involving a surrogate decision maker or a modified consent process that maximizes the client's participation and understanding. Option D. Conduct the diagnostic assessment without explicit consent, based on the professional judgment that the assessment is necessary for the client's well-being, and inform the client of the assessment's completion afterward. Correct answer is C. Conduct a thorough assessment of the client's capacity to consent to the assessment, and if capacity is found to be impaired, proceed with the assessment in a manner that respects the client's dignity and best interests, potentially involving a surrogate decision maker or a modified consent process that maximizes the client's participation and understanding. Explanation. This scenario presents a common challenge in clinical psychology, balancing the need for accurate diagnostic formulation with the ethical imperative of informed consent and client autonomy, particularly when the client's presentation may impact their capacity to fully engage in the process. The American Board of Clinical Psychology, ABCP, Diplomate framework emphasizes adherence to ethical principles and professional standards, which are rooted in U.S. federal and state laws governing mental health practice, as well as professional ethical codes, e.g., APA Ethics Code. The correct approach prioritizes a collaborative and transparent process, ensuring the client understands the purpose, limitations, and potential outcomes of the assessment, even if their current state raises concerns about their full comprehension. This aligns with the ethical principle of respect for persons and their autonomy, and the legal requirement for informed consent. When a client's capacity to consent is questionable, the ethical and legal standard is to assess that capacity, and if impaired, to proceed with the least restrictive means necessary, often involving a surrogate decision maker or a modified consent process that still respects the client's dignity and best interests. The focus remains on empowering the client as much as possible within the constraints of their condition. An incorrect approach that proceeds with a full diagnostic assessment without adequately addressing the client's understanding and consent, or without a formal capacity assessment when indicated, violates the principle of autonomy and informed consent. This can lead to a breakdown in the therapeutic alliance, potential legal challenges, and a failure to uphold professional ethical obligations. Another incorrect approach might be to unilaterally decide that the client lacks capacity and proceed with a diagnostic assessment without exploring less restrictive alternatives or involving the client in the decision-making process as much as possible. This can be paternalistic and undermine the client's rights. Finally, an approach that delays assessment indefinitely due to concerns about capacity, without actively seeking to understand and address those concerns through assessment or consultation, can be detrimental to the client's well-being and access to necessary care. This fails to meet the professional obligation to provide timely and appropriate services. The professional decision-making process in such situations involves a systematic evaluation. 1. Identify the ethical and legal obligations related to informed consent and client capacity. 2. Assess the client's current presentation and its potential impact on their capacity to understand the assessment process. 3. If capacity is questionable, conduct a formal capacity assessment. 4. If capacity is impaired, explore options for surrogate consent or modified consent processes, always prioritizing the client's best interests and dignity. 5. Maintain open communication with the client, explaining the rationale for any decisions made regarding consent and assessment. 6. Consult with supervisors or colleagues when facing complex ethical or clinical dilemmas. Question 13. Analysis of a patient presenting with persistent low mood, anhedonia, significant weight loss, and psychomotor retardation, who also reports recurrent intrusive thoughts of a disturbing nature and occasional avoidance of social situations due to fear of judgment, requires careful diagnostic consideration. Which of the following diagnostic approaches best aligns with the rigorous standards for diplomate-level practice, emphasizing accurate classification within the DSM-5 framework? Option A. Assigning a primary diagnosis of major depressive disorder based on the prominent mood and vegetative symptoms, while noting the intrusive thoughts and social avoidance as secondary features that may be related to the depression. Option B. Conducting a thorough differential diagnosis, systematically evaluating the patient's symptom cluster against the DSM-5 criteria for major depressive disorder, obsessive-compulsive disorder, and other relevant conditions, to determine the primary diagnosis and any comorbid conditions based on the most pervasive impairment and symptom presentation. Option C. Prioritizing the diagnosis of obsessive-compulsive disorder due to the presence of intrusive thoughts, and then considering the mood and vegetative symptoms as potential sequelae of the anxiety disorder. Option D. Diagnosing generalized anxiety disorder given the fear of judgment and social avoidance, and then exploring the possibility of a co-occurring depressive episode. The correct answer is A. Assigning a primary diagnosis of major depressive disorder based on the prominent mood and vegetative symptoms, while noting the intrusive thoughts and social avoidance as secondary features that may be related to the depression. Explanation. This scenario presents a common challenge in clinical psychology, differentiating between a primary diagnosis and a comorbid condition, particularly when symptom presentation is complex and overlaps across diagnostic categories. The professional challenge lies in accurately applying diagnostic criteria from established classification systems, such as the DSM-5, to a unique individual's presentation, ensuring that the chosen diagnostic framework accurately reflects the clinical picture and guides effective treatment. The need for careful judgment is paramount to avoid misdiagnosis, which can lead to ineffective or even harmful interventions, and to ensure appropriate resource allocation and communication with other healthcare professionals. The correct approach involves a systematic and thorough assessment that prioritizes the diagnostic criteria for the most pervasive and impairing condition, while also considering the presence of other disorders. This aligns with best professional practice as outlined by the American Board of Clinical Psychology, ABCP, Diplomate standards, which emphasize evidence-based assessment and adherence to established diagnostic manuals. Specifically, the DSM-5 provides detailed criteria for each disorder, and the clinician's responsibility is to meticulously evaluate the patient's symptoms against these criteria. When symptoms meet criteria for multiple disorders, the clinician must consider the hierarchy of diagnoses, the temporal relationship of symptom onset, and the degree of impairment caused by each condition to determine the primary diagnosis and any comorbid conditions. This systematic approach ensures diagnostic accuracy and facilitates the development of a comprehensive and individualized treatment plan. An incorrect approach would be to make a diagnosis based on a single prominent symptom without a comprehensive evaluation of all diagnostic criteria, or to prematurely assign a diagnosis without ruling out other potential explanations for the symptom cluster. For instance, focusing solely on the most distressing symptom without considering the full spectrum of diagnostic criteria for a particular disorder, or failing to explore the possibility of other conditions that might explain the observed symptoms, represents a failure to adhere to the rigorous diagnostic process expected of a diplomate. Another incorrect approach would be to rely on anecdotal evidence or personal biases rather than the objective application of DSM-5 criteria, which could lead to misclassification and inappropriate treatment. Furthermore, neglecting to consider the impact of cultural factors or other contextual elements on symptom presentation, when relevant, would also be a deviation from best practice and could lead to diagnostic errors. The professional decision-making process for similar situations should involve a multi-step approach. 1. Conduct a comprehensive biopsychosocial assessment, gathering information from multiple sources if possible. 2. Systematically review the patient's symptoms against the diagnostic criteria of relevant disorders in the DSM-5. 3. Consider differential diagnoses, exploring conditions that share similar symptoms. 4. Evaluate the temporal relationship between symptoms and the onset of potential disorders. 5. Assess the degree of impairment and distress associated with each potential diagnosis. 6. Consult with supervisors or peers if diagnostic uncertainty persists. 7. Document the diagnostic reasoning process thoroughly, justifying the chosen diagnosis and any excluded diagnoses. Question 14. Process analysis reveals that a clinical psychologist, operating under the American Board of Clinical Psychology, ABCP, Diplomate framework, is conducting a therapy session with a client who has recently experienced a significant personal loss and is expressing intense feelings of hopelessness and suicidal ideation. The client is not in immediate danger but is clearly overwhelmed. Which of the following crisis intervention strategies best aligns with ABCP ethical guidelines and best practices for managing such a situation? Option A. Offer extensive personal advice and attempt to solve the client's problems directly, becoming deeply involved in their personal affairs to provide comfort. Option B. Minimize the client's feelings by suggesting that their reaction is an overreaction to the situation and encouraging them to snap out of it. Option C. Engage in active listening, validate the client's distress, collaboratively develop immediate coping strategies, and assess the need for a safety plan while maintaining professional boundaries. Option D. Immediately terminate the session and refer the client to a crisis hotline without further assessment or support, citing the intensity of the crisis. The correct answer is C. Engage in active listening, validate the client's distress, collaboratively develop immediate coping strategies, and assess the need for a safety plan while maintaining professional boundaries. Explanation: scenario analysis. This scenario presents a clinically challenging situation requiring immediate and effective crisis intervention. The psychologist must balance the client's immediate distress and safety concerns with the need to adhere to professional ethical guidelines and the specific regulatory framework of the American Board of Clinical Psychology, ABCP, Diplomate. The urgency of the situation, coupled with the potential for harm, necessitates a rapid yet thoughtful application of crisis intervention principles. The psychologist's judgment is critical in determining the most appropriate and ethically sound course of action. Correct approach analysis. The correct approach prioritizes immediate safety and de-escalation while maintaining professional boundaries and adhering to ABCP ethical principles. This involves active listening, validation of the client's feelings, and collaborative problem-solving focused on immediate coping strategies. The psychologist must assess the level of risk and, if necessary, implement a safety plan that may include involving support systems or emergency services, always with the client's informed consent where possible and appropriate. This aligns with the ABCP emphasis on client welfare, competence, and responsible practice in emergency situations. The focus is on empowering the client to manage the immediate crisis while ensuring their safety. Incorrect approaches analysis. One incorrect approach might involve immediately terminating the session and referring the client without a thorough assessment of immediate risk or providing any immediate support. This fails to meet the ethical obligation of providing care in an emergency and could abandon the client in a vulnerable state, violating principles of beneficence and non-maleficence as espoused by the ABCP. Another incorrect approach could be to overstep professional boundaries by becoming overly involved in the client's personal life or making decisions for the client without their input. This can lead to dependency and compromise the therapeutic relationship, potentially violating ethical guidelines regarding professional competence and the maintenance of appropriate boundaries. A third incorrect approach might be to dismiss the client's concerns or minimize their distress, which can exacerbate the crisis and damage the therapeutic alliance. This directly contradicts the core principles of empathy and validation, essential for effective crisis intervention, and is ethically unsound. Professional reasoning. Professionals facing such situations should employ a structured decision-making process. This begins with a rapid assessment of the client's immediate safety and risk level. Next, the psychologist should engage in active listening and empathetic communication to de-escalate the situation. Collaborative problem-solving, focusing on immediate coping strategies and safety planning, is crucial. Throughout this process, adherence to the ABCP ethical code and relevant legal mandates regarding confidentiality and duty to warn/protect must be maintained. Documentation of the intervention and rationale is also a critical professional responsibility. Question 15. Governance review demonstrates that a clinical psychologist has been treating a client who has made increasingly specific and credible threats of serious harm, against a former romantic partner. The client has disclosed the partner's current address and has described a detailed plan for enacting the threats within the next 48 hours. The psychologist has attempted to explore these feelings and plans with the client, encouraging them to consider the consequences and alternative actions, but the client remains resolute in their intent. The psychologist is aware of the legal and ethical obligations regarding client confidentiality and the duty to protect potential victims. What is the most ethically and legally sound course of action for the clinical psychologist in this situation? Option A. Immediately contact the former romantic partner to warn them of the imminent danger and inform the relevant law enforcement authorities of the client's threats and plan. Option B. Advise the client that if they do not agree to voluntarily seek psychiatric hospitalization, the psychologist will be forced to break confidentiality and report the threats. Option C. Continue to explore the client's feelings and motivations, hoping that further therapeutic intervention will dissuade them from acting on their threats, and document these sessions. Option D. Maintain strict confidentiality, as the client has not yet acted on their threats, and any breach would violate the trust essential for therapeutic progress. The correct answer is A. Immediately contact the former romantic partner to warn them of the imminent danger and inform the relevant law enforcement authorities of the client's threats and plan. Explanation. This scenario presents a professional challenge due to the inherent conflict between a psychologist's duty to maintain client confidentiality and the potential need to protect a third party from harm. Psychologists must navigate the complex ethical landscape of balancing these competing obligations, which are often codified in professional ethical standards and legal mandates. The core of the dilemma lies in determining when and how to breach confidentiality, a cornerstone of therapeutic relationships, while adhering to the principles of beneficence and non-maleficence. The correct approach involves a careful, systematic assessment of the risk of harm, consultation with appropriate resources, and documentation of the decision-making process. This aligns with ethical principles that prioritize the prevention of serious harm. Specifically, ethical codes for clinical psychologists, such as those outlined by the American Psychological Association, APA, provide guidance on situations where disclosure may be permissible or even mandated to prevent imminent danger. This approach emphasizes a thorough risk assessment, considering the specificity, imminence, and likelihood of the threat and harm. It also typically involves exploring less intrusive interventions first, such as encouraging the client to disclose the information themselves or seeking to de-escalate the situation. If disclosure is deemed necessary, it should be limited to the information essential to prevent the harm. An incorrect approach would be to ignore the client's statements, thereby failing to assess and potentially mitigate a risk of harm to a third party. This violates the principle of non-maleficence and potentially beneficence if harm can be reasonably prevented. Another incorrect approach would be to disclose confidential information indiscriminately without a thorough risk assessment or consultation, thereby breaching the duty of confidentiality without sufficient justification. This undermines client trust and violates the principle of fidelity and responsibility. A further incorrect approach would be to delay action indefinitely, hoping the situation resolves itself, which could lead to preventable harm and a failure to act responsibly when a clear risk is identified. Professionals should approach such situations by first recognizing the ethical tension. They should then engage in a structured decision-making process that includes 1. Identifying the relevant ethical principles and legal obligations. 2. Gathering all necessary information about the client's statements and the potential threat. 3. Conducting a thorough risk assessment, considering the nature, severity, imminence, and likelihood of harm. 4. Consulting with supervisors, colleagues, or legal counsel as appropriate. 5. Exploring all possible interventions, prioritizing those that are least intrusive while still effective. 6. Documenting the entire process, including the rationale for the chosen course of action. And 7. Implementing the chosen intervention and monitoring its effectiveness. Question 16. Research into the efficacy of cognitive behavioral therapy, CBT, for generalized anxiety disorder suggests that while core principles of cognitive restructuring and behavioral activation are consistently beneficial, the specific techniques and pacing of intervention may need to be tailored to individual client characteristics. A clinical psychologist is working with a client who presents with significant social anxiety alongside generalized anxiety, has a strong preference for highly structured, step-by-step approaches, and expresses a desire to integrate mindfulness practices that have been helpful in the past. The psychologist is well versed in standard CBT protocols for GAD, considering the principles of process optimization in evidence-based practice. Which of the following represents the most ethically and clinically sound approach? Option A. Primarily focus on the client's expressed preference for mindfulness, incorporating only minimal elements of CBT as a secondary component. Option B. Develop novel, highly individualized therapeutic techniques based on the psychologist's clinical intuition, largely disregarding established CBT protocols to ensure a unique and personalized experience. Option C. Systematically integrate the client's preferred mindfulness practices and adapt the pacing and specific examples used in cognitive restructuring and behavioral activation to align with their preference for structure and their social anxiety concerns, while maintaining the core CBT framework. Option D. Strictly adhere to a standardized CBT protocol for generalized anxiety disorder, explaining to the client that deviations are not permissible for optimal outcomes. The correct answer is C. Systematically integrate the client's preferred mindfulness practices and adapt the pacing and specific examples used in cognitive restructuring and behavioral activation to align with their preference for structure and their social anxiety concerns, while maintaining the core CBT framework. Explanation. This scenario presents a common challenge in clinical practice, adapting evidence-based interventions to meet the unique needs of a client while adhering to professional standards and ethical guidelines. The challenge lies in balancing fidelity to the core principles of cognitive behavioral therapy, CBT, with the necessity of tailoring treatment to an individual's specific presentation, cultural background, and expressed preferences. Over-adherence to a rigid protocol can lead to treatment ineffectiveness, while excessive deviation risks abandoning established efficacy and potentially causing harm. The American Board of Clinical Psychology, ABCP, Diplomate credential signifies a commitment to the highest standards of ethical and competent practice, which includes informed decision-making regarding treatment adaptation. The correct approach represents best professional practice because it prioritizes client welfare and evidence-based care through a process of informed adaptation. This involves a thorough assessment, collaborative goal setting, and a systematic integration of CBT principles with client-specific factors. The psychologist maintains a strong foundation in CBT while demonstrating the flexibility and clinical judgment necessary to optimize treatment outcomes. This aligns with the ethical imperative to provide competent and individualized care, as outlined in professional ethical codes that emphasize client-centered practice and the use of empirically supported treatments. The process is iterative, involving ongoing monitoring of progress and adjustment of the treatment plan based on client response, ensuring that the intervention remains relevant and effective. An incorrect approach that focuses solely on rigid adherence to a standardized CBT manual, without considering the client's unique needs or feedback, fails to meet the ethical standard of individualized care. This can lead to a disconnect between the therapist's actions and the client's experience, potentially resulting in treatment dropout or lack of progress. It also neglects the principle of informed consent, as the client may not have agreed to a treatment that does not adequately address their specific concerns. Another incorrect approach that abandons core CBT principles in favor of unvalidated or highly idiosyncratic techniques, without a strong theoretical or empirical rationale, risks providing substandard care. This deviates from the expectation of using empirically supported treatments and could be considered a failure to practice competently. Such an approach may not be grounded in established psychological science and could lead to ineffective or even detrimental outcomes for the client. A third incorrect approach that prioritizes the therapist's personal theoretical preferences over the client's needs or the evidence base for CBT would also be professionally unacceptable. This demonstrates a lack of objectivity and a failure to place the client's well-being at the forefront of treatment decisions. Ethical guidelines consistently emphasize the importance of basing clinical decisions on the best available evidence and the client's best interests, rather than on the therapist's personal biases or theoretical leanings. The professional decision-making process for similar situations involves a continuous cycle of assessment, conceptualization, intervention, and evaluation. It requires the clinician to 1. Conduct a comprehensive assessment to understand the client's presenting problems, strengths, cultural context, and treatment preferences. 2. Develop a case conceptualization that integrates theoretical knowledge of CBT with the client's unique characteristics. 3. Select and adapt CBT techniques in collaboration with the client, ensuring that adaptations are theoretically sound and empirically supported. 4. Continuously monitor client progress and satisfaction, and be prepared to modify the treatment plan as needed. 5. Engage in ongoing professional development to stay abreast of advancements in CBT and its application. Question 17. Governance review demonstrates that a client diagnosed with borderline personality disorder has repeatedly expressed a strong desire to engage in dialectical behavior therapy, DBT, for their treatment. The clinician has conducted an initial assessment and believes that while DBT is a relevant modality, the client's current level of emotional dysregulation and interpersonal instability may present significant challenges to their full engagement with the intensive skills training and therapist consultation team components of standard DBT. The clinician is considering how best to proceed. Which of the following represents the most ethically and professionally sound approach? Option A. Initiate a modified DBT protocol that gradually introduces skills training, focusing initially on distress tolerance and emotion regulation, while closely monitoring the client's progress and readiness for more advanced components, and engaging in ongoing collaborative discussions about treatment goals and adaptations. Option B. Agree to provide DBT but selectively omit or downplay the more challenging components, such as the therapist consultation team, to make it more manageable for the client, without fully disclosing these modifications. Option C. Inform the client that their current level of instability makes them unsuitable for DBT and propose an alternative, less intensive therapy without further exploration of their interest or potential adaptations. Option D. Immediately implement a full standard DBT protocol as requested by the client, assuming their expressed desire indicates sufficient readiness and capacity for all components. The correct answer is A. Initiate a modified DBT protocol that gradually introduces skills training, focusing initially on distress tolerance and emotion regulation, while closely monitoring the client's progress and readiness for more advanced components, and engaging in ongoing collaborative discussions about treatment goals and adaptations. Explanation. This scenario presents a professional challenge due to the inherent tension between a client's expressed desire for a specific therapeutic modality and the clinician's ethical and professional responsibility to provide evidence-based care tailored to the client's unique needs and presentation. The clinician must navigate the client's autonomy while ensuring the treatment plan is clinically sound and aligns with professional standards. The American Board of Clinical Psychology, ABCP, Diplomate framework emphasizes the importance of evidence-based practice, ethical considerations, and client welfare. The correct approach represents best professional practice because it prioritizes a thorough assessment and collaborative treatment planning process. This aligns with ABCP guidelines that mandate comprehensive evaluations to inform treatment decisions and uphold the principle of beneficence. By exploring the client's understanding of DBT, their specific goals, and their readiness for its intensive components, the clinician ensures that the proposed treatment is not only desired, but also appropriate and likely to be effective. This collaborative approach respects client autonomy while maintaining professional integrity and adhering to ethical standards of competence and due care. An incorrect approach that focuses solely on fulfilling the client's stated preference for DBT without a thorough assessment fails to uphold the clinician's responsibility to provide competent and appropriate care. This could lead to a mismatch between the treatment and the client's actual needs, potentially resulting in therapeutic failure, client frustration, and a breach of ethical obligations related to informed consent and evidence-based practice. Another incorrect approach that dismisses the client's interest in DBT outright, without adequate exploration, risks alienating the client and undermining the therapeutic alliance. This could be seen as paternalistic and may violate the principle of respect for autonomy, potentially leading to a premature termination of therapy or a lack of engagement. A third incorrect approach that involves misrepresenting the efficacy or applicability of DBT to the client's specific situation would constitute a serious ethical violation related to honesty and informed consent. This undermines the foundation of trust essential for effective therapy and violates professional standards of accurate communication. The professional reasoning process in such situations should involve a systematic approach. 1. Conduct a comprehensive biopsychosocial assessment to understand the client's presenting problems, strengths, and treatment history. 2. Explore the client's understanding of and rationale for requesting DBT, including their expectations and perceived benefits. 3. Educate the client about DBT, including its core components, evidence base, and suitability for their specific issues, while also discussing alternative evidence-based treatments. 4. Collaboratively develop a treatment plan that integrates the client's preferences with the clinician's professional judgment and the evidence base, ensuring informed consent is obtained. 5. Continuously monitor treatment progress and adapt the plan as needed, maintaining open communication with the client. Question 18. The risk matrix shows a standardized cognitive assessment administered to a client yielded a score significantly below the expected range based on the client's reported educational background and prior academic performance. The psychologist is considering how to proceed with the interpretation and integration of this finding into the overall assessment. Option A. Focus solely on the statistical deviation of the score from the norm, without exploring the potential underlying reasons for the discrepancy or its practical implications for the client's daily functioning. Option B. Interpret the score cautiously, considering potential factors that may have influenced performance, e.g., test anxiety, fatigue, cultural background, specific learning challenges not previously identified, and integrating it with other qualitative and quantitative data from the assessment to form a comprehensive understanding of the client's cognitive functioning. Option C. Disregard the standardized test score entirely, assuming it is an invalid measure for this particular client, and rely exclusively on informal observations and subjective reports. Option D. Immediately conclude that the client has a significant cognitive deficit and proceed with a diagnosis based solely on this score, without further investigation or consideration of other factors. The correct answer is B. Interpret the score cautiously, considering potential factors that may have influenced performance, e.g., test anxiety, fatigue, cultural background, specific learning challenges not previously identified, and integrating it with other qualitative and quantitative data from the assessment to form a comprehensive understanding of the client's cognitive functioning. Explanation. This scenario presents a professional challenge due to the inherent variability in standardized test scores and the potential for misinterpretation or misuse of these scores in clinical decision-making. The psychologist must balance the utility of standardized measures with the need for a comprehensive, individualized assessment that considers the client's unique context. Careful judgment is required to avoid over-reliance on a single data point, and to ensure that assessment findings are used ethically and effectively to benefit the client. The correct approach represents best professional practice because it aligns with the ethical principles of the American Psychological Association, APA, which are foundational for the American Board of Clinical Psychology, ABCP, Diplomate certification. Specifically, it adheres to the standards for educational and psychological testing, SET, which emphasize the importance of using tests appropriately, considering their psychometric properties, and integrating test data with other relevant information. This approach prioritizes the client's well-being by ensuring that diagnostic and treatment decisions are based on a holistic understanding of the individual, rather than solely on a numerical score. It also reflects a commitment to professional competence by acknowledging the limitations of standardized tests and the need for clinical judgment. An incorrect approach that relies solely on the obtained score without further investigation fails to acknowledge the potential for measurement error, the influence of situational factors on test performance, and the need for convergent validity. This could lead to misdiagnosis or inappropriate treatment planning, violating the ethical principle of beneficence and non-maleficence. Another incorrect approach that dismisses the standardized test entirely without considering its potential utility or the reasons for the discrepancy ignores valuable information that, when properly contextualized, could contribute to a more accurate understanding of the client. This may represent a failure to maintain professional competence by not utilizing available assessment tools appropriately. Third incorrect approach that focuses on the statistical significance of the score without considering its clinical significance or the client's functional impact overlooks the practical application of assessment results, which is crucial for effective intervention. This can lead to a disconnect between assessment and the client's lived experience. Professionals should employ a decision-making framework that begins with understanding the purpose of the assessment and the client's presenting concerns. They should then select appropriate, psychometrically sound assessment tools, considering their validity and reliability for the specific population and purpose. Following administration, results should be interpreted within the broader context of the client's history, behavior, and other assessment data. This involves critically evaluating the meaning of scores, considering potential sources of error or bias, and integrating findings into a comprehensive formulation that guides intervention. Ongoing professional development and consultation are also vital to ensure the appropriate and ethical use of standardized testing. Question 19. Which approach would be most consistent with the American Board of Clinical Psychology, ABCP, Diplomate's commitment to evidence-based practice and ethical standards when assessing and conceptualizing a client presenting with a complex array of emotional and behavioral difficulties? Option A. A rapid diagnostic impression based on initial client presentation, prioritizing symptom relief through a favored theoretical intervention. Option B. A conceptualization driven primarily by a clinician's preferred theoretical model, interpreting all client behaviors through that lens regardless of empirical support. Option C. A comprehensive diagnostic assessment utilizing validated instruments and adherence to current diagnostic criteria, followed by a treatment plan informed by empirical research and the client's specific needs. Option D. A broad diagnostic categorization based on a single prominent symptom, without extensive psychometric evaluation or consideration of differential diagnoses. The correct answer is C. A comprehensive diagnostic assessment utilizing validated instruments and adherence to current diagnostic criteria, followed by a treatment plan informed by empirical research and the client's specific needs. Explanation. This scenario presents a professional challenge due to the need to accurately diagnose and conceptualize psychological disorders within the framework of established diagnostic criteria, while also considering the ethical imperative to provide effective and evidence-based treatment. The complexity arises from the potential for symptom overlap between disorders and the importance of avoiding premature or inaccurate diagnostic conclusions that could lead to suboptimal care. The correct approach represents best professional practice because it emphasizes a systematic, evidence-based, and comprehensive evaluation process. This aligns with the core principles of clinical psychology, which mandate the use of validated assessment tools and adherence to diagnostic manuals such as the DSM, Diagnostic and Statistical Manual of Mental Disorders, as recognized and implicitly endorsed by professional bodies like the ABCP. This approach ensures that diagnoses are grounded in empirical data and clinical consensus, facilitating appropriate treatment planning and communication with other healthcare professionals. It upholds the ethical obligation to provide competent and effective services, minimizing the risk of misdiagnosis and its associated negative consequences for the patient. An incorrect approach that relies solely on a single theoretical orientation without empirical validation fails to meet the standards of evidence-based practice. This can lead to biased interpretations of client presentation and potentially inappropriate treatment interventions, violating the ethical principle of beneficence and non-maleficence. Another incorrect approach that prioritizes symptom reduction over a thorough diagnostic assessment risks treating superficial manifestations rather than underlying disorders, potentially leading to treatment failure and patient dissatisfaction. This neglects the ethical duty to provide comprehensive care. An approach that focuses on labeling the client without a detailed understanding of the disorder's specific criteria and impact on functioning overlooks the nuanced nature of psychological disorders and the importance of individualized treatment, potentially leading to stigmatization and ineffective interventions, which is ethically problematic. Professionals should employ a decision-making framework that begins with a thorough intake and history, followed by the administration of appropriate psychometric assessments. This data should then be integrated with the clinician's theoretical knowledge and applied to the current diagnostic criteria, e.g., DSM-5-TR. Treatment planning should be a collaborative process, informed by the diagnostic formulation and evidence-based practices, with ongoing monitoring and reevaluation of the client's progress and diagnostic status. Question 20. The review process indicates that a candidate for ABCP Diplomate certification has presented case material from a client engaged in existential psychotherapy. The candidate's self-report emphasizes the therapist's role in facilitating the client's exploration of meaning, freedom, and responsibility, with interventions described as primarily reflective and supportive of the client's self-discovery. The review committee requires further clarification on how this approach demonstrates adherence to the rigorous standards of clinical practice expected for diplomate status, particularly concerning the articulation of therapeutic goals and the demonstration of measurable progress within the humanistic and existential framework. Option A. The candidate should explain that existential psychotherapy is inherently non-directive and focused on the client's subjective experience, and that traditional measures of progress are not applicable to this modality. Option B. The candidate should provide a detailed rationale for how the reflective and supportive interventions are designed to address specific client-identified existential concerns, outlining how the client's exploration of meaning, freedom, and responsibility is expected to lead to measurable improvements in psychological well-being and functioning, consistent with established benchmarks for therapeutic outcomes. Option C. The candidate should assert that the client's self-reported insights and personal growth are the sole indicators of therapeutic success in existential therapy, and that further justification is unnecessary. Option D. The candidate should present a revised case conceptualization that incorporates a more structured, cognitive behavioral framework to demonstrate measurable progress, as this is more aligned with typical ABCP expectations. The correct answer is B. The candidate should provide a detailed rationale for how the reflective and supportive interventions are designed to address specific client-identified existential concerns, outlining how the client's exploration of meaning, freedom, and responsibility is expected to lead to measurable improvements in psychological well-being and functioning, consistent with established benchmarks for therapeutic outcomes. Explanation. This scenario presents a professional challenge in applying humanistic and existential therapeutic principles within the ethical and regulatory framework of the American Board of Clinical Psychology, ABCP, Diplomate certification. The core challenge lies in balancing the client's subjective experience and self-determination, central to these therapeutic modalities, with the objective requirements of demonstrating competence and adherence to professional standards expected by the ABCP. The review process necessitates a clear articulation of how the psychologist's interventions align with established psychological practice and ethical guidelines, even when working with therapies that emphasize individual meaning-making and non-directive approaches. The correct approach represents best professional practice because it demonstrates a nuanced understanding of how humanistic and existential theories can be integrated into a structured, evidence-informed, and ethically sound clinical practice. This involves clearly articulating the therapeutic goals, the rationale for specific interventions, and how these interventions facilitate the client's growth and self-understanding in a manner that is consistent with the ABCP expectations for diplomate-level practice. It emphasizes the psychologist's role in fostering the client's agency while maintaining professional responsibility for ethical conduct and competent service delivery, aligning with the general ethical principles of the American Psychological Association, APA, which underpin ABCP standards. An incorrect approach that focuses solely on the client's immediate subjective experience without demonstrating a clear therapeutic strategy or rationale would fail to meet ABCP standards. This would be a regulatory and ethical failure because it could be interpreted as a lack of professional accountability and a deviation from the expected rigor of diplomate-level practice. It risks misrepresenting the therapeutic process as purely conversational rather than a deliberate application of psychological principles. Another incorrect approach that prioritizes a specific existential interpretation over the client's unique journey would also be ethically problematic. This represents a failure to uphold the principle of client autonomy and could lead to imposing the therapist's worldview, which is contrary to the client-centered nature of humanistic and existential therapies and the ethical imperative to avoid undue influence. A third incorrect approach that neglects to document the therapeutic process and outcomes adequately would be a significant regulatory and ethical failure, as it hinders professional accountability, peer review, and the ability to demonstrate the effectiveness of interventions, all of which are implicitly required for certification. The professional decision-making process for similar situations should involve a continuous self-assessment of how theoretical orientations are translated into practical, ethical, and accountable clinical actions. This includes clearly defining therapeutic goals in collaboration with the client, selecting interventions that are consistent with both the chosen therapeutic modality and ethical guidelines, and meticulously documenting the process and outcomes. Professionals must be prepared to articulate the rationale behind their therapeutic choices, demonstrating how they uphold client welfare, autonomy, and professional standards, even when employing less directive or more interpretive therapeutic approaches.